Center and in some universities, and I'm also connected to Kenya. And so in Dutch, I am artsmaatschappij en gezondheid for medical doctors who are interested in infectious disease control, for example. What are the learning goals today? We are going to discuss basic principles in public global health, the Millennium Development Goals. We are going to speak about economy and public health and economy. I am going to explain you why some countries are poor, especially in sub-Saharan Africa. I'm going to give some commentary on Millennium Development Goals and to show you them up till 2015. I will make some conclusions and discuss some items in the Sustainable Development Goals up to 2020. Many slides in this presentation, I'm famous for it, but I will give them to you so that you can study them afterwards in peace. So don't worry too much, please. Part 1. What do people want when it comes to health? Who can give me an answer on that?
Well,
Marloes, yeah? I'm listening.
well, I think they want quality care for the lowest price as possible.
Yeah, that's a very nice answer. Quality for the lowest price. Yeah, that is very modern thinking from a perspective of economy, but it's not bad at all, but it is not only about economy. So what people do want is a growing old in good health and equally distributed health over the world, isn't it? You want to share things. And in my former lecture, I was already speaking about John Rawls, who was thinking about justice. And he found out when you look at from the veil of ignorance that people want equal rights, equal basic liberties, liberty for all, and the greatest benefit of the least advantage if you want to design a society. So if you don't know who you are going to be in that society, you will always think about what should I like to happen if I am poor and not very clever. So that is equality of opportunities. So is the health evenly distributed through the world? Let me show you. I was speaking already about the Black Report in 1980. Then it was found out, although there is a social security system in England, there is a big difference in health between the poor and the rich. And so that inspired people to think about it and what to do about it. So later, so when you look, for example, in 2012 to the life expectancy at birth, there is a huge difference between different regions. The life expectancy in some regions in Africa is still below 50, but in some areas above 90 even. And that is the healthy life expectancy, that you live in good health before you die. That is also not very evenly distributed all over the world. So there is quite some difference. I show you again how to calculate morbidity and mortality. We use disability adjusted life years. There's a combination of mortality and morbidity. And the mortality is the years of life lost before. So if you lose years of life before you reach the average expected age, that are the amount of years you can lose. And if you're ill you can be disabled, and there is a kind of measurement for disability. And that is being used, and the combination gives you dollies. So if you look to the age standard disability adjusted life years lost in the world, it means how many years are being lost because of mortality and morbidity. You see a huge difference in the world. And so on that level also, there is no evenly spread. So distribution of public health care as well. So if you look to the gross domestic product and the percentage of it being used for health care, there are huge differences. For example, in the Netherlands, we use more than even 13% at this moment, and the United States as well. But in some countries, it is like in China, it is only 4%, and in some regions like Kenya, less than 4 and 3. So health and healthcare are not even distributed through the world. Is it fair that health is not evenly spread through the world? That is most probably what most people don't want. Do doctors have a responsibility when it comes to an even spread of health through the world? What do you think? Who wants to answer or give comments on this question? Rick dressing himself up nicely. Nobody? What do you think, future doctors? Marloes Monster?
Yeah. I don't know. Do doctors have a responsibility? I think all humans have a responsibility.
Okay, nice answer. So we should really care, isn't it? So let me show you about Millennium Development Goals. They were developed in the year 2000, and they are still worth the effort to learn about. What were the Millennium Development Goals? It were 8 international development goals with 21 targets accepted by 192 United Nations member states and 23 international organizations, and they agreed to achieve Millennium Development Goals in 2015. Here you see some people together of the United Nations states, and you see even people from Russia and all over the world. And the United Nations headquarters show proudly these MDGs. They go about poverty, education, gender equality, child health, maternal health, combat HIV, environmental sustainability, and global partnership. So let me mention all of them. MDG 1 is eradicate extreme poverty and hunger between 1990 and 2015, and halve the proportion of people whose income is less than $1 a day. Imagine $1 a day. Achieve full and productive employment and decent work for all, including women and young people. Halve the proportion of people who suffer from hunger. MDG 2, ensure that children everywhere, boys and girls alike, will be able to complete a full course of primary schooling. 3, eliminate gender disparity in primary and secondary education, preferable by 2005 and at all levels by 2015. Reduce child mortality by 2/3 if you speak about under 5 mortality rates. So that is the probability of dying under the age of 5 years. Improve maternal health. Reduce by 3/4 the maternal mortality ratio rate the MMR and achieve universal access to reproductive health. There is a mother dying in 1863, so maternal mortality was always a big issue in the lives of people, and it is still in many regions in the world. I will show you. Have halted by 2015 and begun to reverse the spread of HIV/AIDS, achieved by 2010 universal access to treatment for HIV/AIDS for all those who need it. They have halted by 2015 and begun to reverse the incidence of malaria and major diseases like TB. 7, ensure environmental sustainability. Integrate the principles of sustainable development into country policies and programs and reverse loss of environmental resources. Reduce biodiversity loss, achieving by 2010 a significant reduction in rate of loss. Halve the proportion of people without sustainable access to safe drinking water and basic sanitation. By 2020, to have achieved a significant improvement in the lives of at least 100 million slum dwellers. And develop further an open trading and financial system that is rule-based, predictable, and non-discriminatory, includes a commitment of good governance, development, and poverty reduction nationally and internationally. And address special needs of the least developed countries, and that this includes access for their exports, debt relief and cancellation of official bilateral debt, and more generous official development assistance for countries committed to poverty reduction. And address the special needs of landlocked and small island developing states and deal comprehensively with the debt problems of developing countries through national and international measures in order to make that sustainable in the long term. And maintenance at a certain rate of level means sustainability or upholding or defending. And then in cooperation with pharmaceutical companies, provide access to affordable essential drugs in developing countries. In cooperation with the private sector, make available the benefits of new technology as special information and communications. So what is striking about the MDGs? Suhail Uyar, could you give an answer?
In English?
If you, yes, of course.
Wait 1 second. What is striking about the MDGs? I don't think I can give a good answer right now. I don't think I have enough information about this. I know enough about this.
But try. Who tries? You as future doctors, what is striking about the MDGs?
Most of them are about health.
Very good. It's not only about health. Might be at the end, but
I would say what is striking, they have not been reached, and the goals were in 2015.
yeah, but that is about the future. But when you look to these, how are they composed? What is the composition? Let me explain you. So it is about poor countries. It is about poverty, schooling, gender, health, and environmental issues. And it is about international community of rich countries, they should cooperate with develop a global partnership for development. So it is not only about health, it is about more things. So if you want at the end to have good health, maybe you have to think about other things as well. But it is about many issues which are important for the well-being of people. So they are about improvement of public health and improvement of economy, and they are about international cooperation. They are about less about how. Nobody tells how to do. It is more about goals and timelines, what and how much and when. And that is also the critic sometimes. It is a kind of ideology, and does it work? That is the question. So why are MDGs about improvement of public health and economy? I'm going to explain you. So we are now speaking about Millennium Development Goals, but they succeeded the Alma Ata Declaration Health for All through primary health care. That is what we explained to you in my former lecture with Peter van der Homberg. In those days, they have chosen as well for a multi-sectoral approach. Right? Also, when you speak about improvement of health. Because what are the determinants of public health? I ask you, how do your diseases arise? And they show you again, it has nothing to do with devils or gods. It has everything to do with interaction between host, agents, and environment. And the characteristics of these are the determinants of and risk factors of disease and the potential targets to control disease. So the determinants of health are multi-sectoral. So you can look to them, for example, the social circumstances of people, like their economic system or their political system, their human rights situation, the availability and accessibility of education, that all has influence on the public health in a country. Besides whether there is a good healthcare system or not. It is about smoking, it is about alcohol misuse, it is about drugs, it is about road traffic accidents, and so on and so on. So therefore, these MDGs have a broad spectrum, because health is determined by the healthcare system, lifestyle, biological and genetical factors, but also the surrounding. So what are the determinants of difference in health between populations? If you want that they decline, it is the same. So these are also the determinants of difference in health. So let me show you examples of public health and socio-economic status, for example. In the Netherlands, if you look properly in the Netherlands and you look to life expectancies, you can see that in the days of MDGs, there was quite a difference in life expectancy, even in the Netherlands. When you came from the deep south, your life expectancy was 2 years shorter than when you came from Gouda or any place in the West. So there was a significant difference, and it is still, between different regions in the Netherlands. And when you look to where the poor people live, like in the northeastern part here in Groningen, for example, that are also the places where the life expectancy is lower. But what is shown here. So if you look on the level of municipalities, the life expectancy in Kerkrade is 8 years lower than the life expectancy in Blaricum. So even in the Netherlands, there is a big difference. While we are a social justice rich country. So our Dutch national budget, which is going to be presented very soon, is based on this knowledge. When you look to our national budget, the state budget, you see that of the 336 million euros we spent, nearly 100 million go to social security and job markets, because we know that these have huge impacts on people and their health. And we spent nearly 100 billion euros on healthcare. That is more than 6,000 per person per year. So that is why we are a social security country. We spend half of our budget on social security, job market, and healthcare. Now we go to socio-economic situation and public health in the world. But if you look to prosperity and life expectancy, we use gross domestic product as the value of all final goods and services produced within a nation per year. So that is, in the Netherlands, it is around 820 billion. And when you look to the gross domestic product per capita in the world, you see huge differences. You see very rich countries, but also poor countries when you look to what they produce. So the spread of prosperity is not evenly spread all over the world. In Africa and in some Asian countries, there is a big amount of poverty. And it is so related to life expectancy. So life expectancy and per capita income are very strongly related to each other, but shows this slide, and it was already in 1900 and it is still going on. So mortality in low and high income countries, low and middle income countries, 85% of the world population lives there, and they have 98% of child mortality and 28% of all mortality, while in the high income countries, 50% of the world lives and they have less than 1% of child mortality. So the prevalence of MDG 6 diseases and socioeconomic status countries, when we look to HIV/AIDS in relationship to prosperity, you again can see that the most AIDS is in the lowest income countries. It is also for malaria, so the spread of prosperity and the malaria cases per 100,000 people. TB, the same. TB is the disease of poverty. If you're poor, your immune system doesn't work properly. So if you get your TB infection, it will easily develop to TB disease, and that is what is happening. And that is the same case for the combination of HIV and TB. So poverty in the world in the year 2000, half of the world, over 3 billion people in 2000 live of less than $2.5 a day. And the gross domestic product of the 41 heavily indebted poor countries with more than 500,000 people is less than the wealth of the world's 7 richest countries combined. Nearly 1 billion people entered the 21st century unable to read a book or sign their names. And 1 billion children live in poverty, 1 in 2 children in the world. 650 million live without adequate shelter, and 400 million without no access to safe water, and 270 million have no access to health services. That is the situation in the year 2000. And poverty leads to, and that is the explanation, lack of schooling, lack of knowledge, poor housing, unsafe drinking water, bad sanitation, poor health care, poor nutrition, and insecurity. So public health is the result of many determinants, among which the socio-economic status of countries and people. Difference in wealth explains difference in health. So this is what I like to show you for the people who think that health is only brought by curative sector. That is not the case at all. There is no necessary biological reason why life expectancy should be 40 years longer in Japan than in Sierra Leone, or 20 years shorter in Australian Aboriginal and Torres Strait Islander people than in other Australians. So that is the reason why the MDGs go about schooling, health, economy. So now we go to why are countries poor? And they go to Sub-Saharan Africa, because that is a region still lying behind even in these days. What is the economic situation in Africa? In 2005, there were 750 million people with a gross national product per capita of $742. We have one of more than 40,000. Population growth was 2.6, and the gross national product growth was 2.1% up till 2000, and later on 4%. And the life expectancy was 47 years, and development cooperation gave $40 per person per year. So since 1820, the lowest economic growth was in Africa, if you that compare to the other regions of the world. From 1820 up till 1992, it was the lowest. And the question is, why? So if you look more carefully to the different periods, you can say that it is before colonial times, when the colonial times start, during the World Wars and the Great Depression, late colonial and early independence times, and also the period of independence. After 1992, growth is slower than in the rest of the world, even though not expected. Growth in Africa in all times period lowest, although that is changing since 2000. But if you look from 1820 to 1992, you always see that Africa has the least economic growth. And Africa's share of the world income and population, so the income compared to the population growth is not very nice for Africa. And also at this moment, when you look to Sub-Saharan Africa, you see that the annual growth of real gross domestic product per employed person is still below 0. So why is Sub-Saharan Africa poor compared to most other parts of the world? There are different explanations. It is up to the Western world. It is due to Africa itself. It's due to all kinds of accidental circumstances, so it is nobody's fault. And there are also explanations. But let me go into some hot items. It is up to the Western world, the slave trade, the colonial past, unfair trade, Cold War. Now, slave trade is discussed and as a white man from Western Europe, I'm scared to speak about it. But I want to say something about it. It was, of course, a horrible time. It was serious, but it exists still. If you ask me in which times were the most slaves, I can't tell you it is now at this moment, not in the past. But in the past, it was very serious. And might be it gave a lot of economic deprivation, but that is not accepted by everybody. Slavery and the role of Africa is a difficult conversation because it was not only the Western world who were involved, it was trade between several parties, including African tribes and kingdoms. And don't get things twisted. That is what the mother of Hanu Billiot tells us. So in Ghana, for example, kingdoms became very rich because of slave trade. And also Amsterdam became very rich and many Western countries. In those days, economy was dependent on slave trade. So it might have been an explanation. It is due to Africa itself. There are hypotheses from Max Weber who says the Protestant Reformation and its ethics played a key role in the rise of modern industrial societies in the Western world, and it resulted in beliefs, values, and ethics, and what made Western world very rich. It is due to Africa itself, the culture, hypothesis it is. It is due to tribes and tribalism. It is about extended families and patronage networks, corruption and poor governance and wars. It is due to all kinds of accidental circumstances as another theory. Since 1700, Africa remains similar and the rest of the world has changed. Poverty is a relative measure in Western economy. Africa, a second explanation, is a large geographical disadvantaged area, and Africa has unfavorable demographics. Let me show you. Large geographical disadvantaged. That is an old theory of Montesquieu, Diamond in the 20th century. I advise you to read the book Guns, Germs and Steel. And also Jeffrey Sachs in the 21st century says that Africa is geographically disadvantaged. It is very large and it is situated unfavorable around the equator. So how large it is, and can it explain something? In understanding Black Africa, geography is more important than history. Geography is not all that matters, but it is the most significant. That is what Brodel says in 63. So the large area makes cultural interaction more difficult between Africa and the rest of the world and within Africa. And Sub-Saharan Africa is the world's tropical region par excellence, with 93% of its land area within the geographical tropics. So how big is Africa? It is huge. Let me show you. The United States can easily go in the Sahara. India can go into Ethiopia and Sudan. We can add Japan and Europe easily, and England, we have to separate England now because of Brexit. It can be put somewhere in Africa as well. So it is a huge continent and New Zealand is here as well. So what are the disadvantages? Relative large and relative small interior coastline. So transport of products difficult and expensive, especially around the equator. The climate, hot and unfavorable for agriculture. The soil, unfavorable for agriculture. Ecology, bad for public health, beneficial for presence and maintenance of, for example, infectious diseases like malaria. The economy around the equator is less well almost everywhere, and Africa has a very big area around the equator. So if you look to the per capita income in different latitudes, you see that around the equator, the per capita income is low all over the world. If you look to the purchasing power parity, that is less. What is that? The gross, you have the gross domestic product, the value of all final goods and services produced within a nation per year, and the purchasing power parity, it takes in account the relative cost of living and inflation rates of the country. So what can you buy for $1 in New York, and what can you buy for $1 in Africa, for example? So then you see that the purchasing power is lower in Africa of money. And the proportion of total PPP adjusted for gross domestic product by latitude, then you see that the areas around the equator are disadvantaged. So 69% falls within the range of the 20 north and 60 north situation, and 12% lies within the range of 20 north to 20 south. So the hot areas are disadvantaged, and agriculture around the equator is not doing very well. It has to do with temperature, soil, altitude, rainfall, nighttime, respiration, clothing, and photosynthesis. If you want to become a farmer in Africa, your crop will be less because of the photosynthesis problem. It's too much sun, and the infectious diseases around the equator in Africa and their impact on development economy is also an issue. So infectious diseases love the climate of sub-Saharan Africa, India, and Europe. As less. So the DALY's loss due to infectious diseases are very high in Africa compared to Europe. Infectious disease find good ecological circumstances in Africa, and Africa has poorest health status of any region of the world, due to for example, malaria. And malaria is more prevalent, it gives more morbidity and mortality, and it requires a lot of medical expenses for African people. It gives them loss of working days, school loss, negative impact on cognition, and the direct costs on the gross domestic product are around 1%. And what is more important, even that people don't like to go to malaria areas for investment. So industry don't like to go to malaria areas. So malaria is bad for economy. And then the demographic situation in Africa is unfavorable. Low life expectancy leads to lower economic growth, and population density and urbanization, and that is important as well. So when you look to the population density, it is lower around the equator, and the population density by latitude the population is lower and the population density as well. So there are less people living per square kilometer. So if you're in that situation, you have relative high cost for infrastructures like roads, ports, sewage, water supply. So if you have 2 people per square kilometer, it is very difficult to make these issues. So relative many different languages are also in Africa and different cultural groups, and that all is bad for economy. A very important issue is the delayed demographic transition in Africa. Let me explain you. In Africa, there is already less mortality, but not less fertility. So relative many young people in the reproductive age are living in Africa. So tremendous growth of populations under the age of 60 years. And that is shown. So the population by age in millions is given here. These are the specific age groups, and these are the years from 1950 to 1959. So what you see is that there is a tremendous amount of people in the ages below 16, 18. And that is not productive age. And people under 18 are costing money. So Africa has a population which is not really in the productive age. HIV and AIDS is a large problem in sub-Saharan Africa, but also in Russia, for example. But Africa was remains extremely vulnerable to HIV due to economic, social, and cultural and linked to demography. Why linked to demography? So if you look to the prevalences, you see high ones in Africa, and what are factors? High rates of multisexual partnering, high rates of sexual transmitted diseases, which make more easy to be infected, the use of untested contaminated blood and blood products and non-sterile medical practices were and are still the case, and the reliance on breastfeeding with a higher risk on HIV transmission from infected mothers to children, a lower rate of condom use. Condoms are not really accepted in Africa, and low levels of education. So very high proportions of populations in sexual active years, because it is a very young population. So many people have a lot of sex in these populations. So this is one of the explanations. Large number of intracontinental migrants and refugees, high rates of urbanization, especially young men seeking seasonal work. So what you see is that you have to go far to find jobs. Many young people go to cities, and they are going to live many times in slums and dense population cities, and that gives a spread of HIV through increased anonymity and separation from families. So, and HIV gave a lot of costs, the medical treatment and the indirect costs like income among working groups. When you have HIV and you're not treated well, you're not very much able to work, and people fear to go to HIV areas. When you look to the Ebola area, many big companies were leaving Africa, and that gives a loss of income. So HIV is bad for economy. So answers on questions, why is sub-Saharan Africa poor? It might be nobody's fault. The economy depends on geography, demography, and health. Are there also explanations? There are. I will show you later on. But my conclusion is difference in wealth explains difference in health. Difference in health explains difference in wealth. And therefore, MDGs are based on health and wealth. Okay. We go to commentary on MDGs. So it was not the first time that we do this kind of goals, and many goals are set, 448. And for Africa, it is nearly impossible to achieve most of them because of the chosen reference point. The year 1990 was still a bad year, and if you choose for proportional reduction for evaluation, then you are bad off. If you do it in absolute reduction, it is more easy. When 100 is bad and 0 is good, you do it in absolute reduction, for example, 20%, and when you go from 100 to 80, it is still 20%, but proportional is just a small reduction compared to going from 20 to 0. MDGs for Africa have a serious downside. Jeffrey Sachs, he is the figurehead of the United MDGs. He was the one really behind, but also the Netherlands was very much behind. Our Ministry of Foreign Affairs really wanted these MDGs. But this is Mr. Jeffrey Sachs, and he says poor health, education, and infrastructure ensures a vicious circle, a poverty trap. With capital, the circle can be broken, and there are many examples where if you give $5 to mothers, that might result in 5 million fewer child deaths. Mothers, when you give them money, it works very effectively to lower child deaths and to increase economy. And Sachs answers a strong moral appeal. We can make poverty history. It is a shame that poverty still exists. And the GA decided to double from 25 million to 15 billion support in 2005. And it is and was the dominant view doing good and charity are and were in. So he's really behind MDGs. But then William Easterly is a cool analyst asking questions about usefulness of the goals and the effectiveness of aid. He says rich people have markets and poor people have bureaucrats. So the last 50 years, says Easterly, we have spent a lot of money. 2,300 billion, and we did not manage to get that $5 to the masses. Why should we now succeed? Help only contributes to limited development. There is a need for practical solutions, also reward performance, no plans. Do what works. We must get rid of the something is being done syndrome. We must get rid of aid addiction and fads. And he shows this type of picture. Donor collaboration is a challenge because it is so difficult organized. When you look to the support to one African country and how it has to organize the support given by all types of governments and organizations, it is something that leads to a lot of bureaucracy. So let us go to part 6. I'm going to ask you, who believes that the Millennium Development Goals have been achieved? Can some people say that they don't believe that They have been achieved? Simone Oomstede, what do you think?
I don't think the Millennium Development Goals have been achieved.
And so you are pessimistic.
Yes, I am.
Yeah. And Danielle?
I also don't think it has been achieved. Actually.
Not being achieved. And Valerie Eekema?
I don't believe they have been achieved, no.
You're also pessimistic. Okay. If there's a random sample, nobody believes that it works. So let us go to the MDGs in 2015. So look in these Millennium Development Reports. They are very interesting to read also for doctors. So these 8 Millennium Development Goals, I'm going to show you what happens. First of all, the eradicate extreme poverty and hunger. Where do we stand? The global mobilization behind the MDGs has produced the most successful anti-poverty movement in history, according to UN Secretary General Ban Ki-moon. So in 1990, we had 1.9 thousand million people in extreme poverty, and it was tremendously reduced to less than 1 billion. So was in 1990 47% extreme poor. In 2015 it was only 14%, and that on the level of $1.25 a day. And China is doing very well, but sub-Saharan Africa still not doing very well. Hunger, proportion of undernourished people in the developing regions has fallen by 50%. And here you can see that the developing regions are doing quite well, but sub-Saharan Africa goes from 33 to 23% when it goes about the proportion of undernourished people. But China is doing very well. It goes from 13 to 10. Children underweight. In 1990, 1 in 4, in 2015, 1 in 7. So very well. So on world level, it really decreases, and sub-Saharan Africa is also doing well, but it started on 29, it goes to 20, and that is proportionate, is low, but it is still 9%. Employment. Unhappily, the employment didn't decline really because of a growing labor force. More and more people were looking for jobs because of increase of populations. But what you see is that the extreme poor, less than 125, become less, and the near poor are doing better. So the better groups become bigger and the bad groups become smaller. Workers living in extreme poverty has fallen sharply from 52 to 11%, and also, but in sub-Saharan Africa, you see this type of percentages still. Work conditions. Despite progress, almost half of the world employed people work in vulnerable conditions. Millions forced leaving home. So the conflicts have forced almost 60 million people between 2000 and 2015 to flee from their homes. Goal 2, primary education. Where do we stand? There is a considerable progress has been made in expanding primary education enrollment since 1990, and particularly since adoption of the MDGs in 2000. Primary school, between 1990 and 2012, number of children enrolled in primary schools in sub-Saharan Africa have more than doubled from 62 to 149 million. Primary schools net enrollment rate in developing regions has reached even 91% in 2015, up from 83% in 2000. So in sub-Saharan Africa, the enrollment rate in primary schools really increased from 52 to 80%. The literacy rate, and we mentioned people aged 15 to 24, and that increased globally from 83 to 91%. That is not bad at all. The gender gap literacy rate, the gender gap in youth literacy has fallen since 1990, and a greater proportion of all youth can read and write. So girls are doing well. Out of school. Global out-of-school children of primary school age have decreased from 100 to 57 million. The number of out-of-school children being cut almost half since 2000. And that is especially the case in Southern Asia. So China is doing very, very well. And sub-Saharan Africa still not very well. So out of school children, 33 of 57 million are still in sub-Saharan Africa, and more than half are girls. So girls that you can become doctors in the Netherlands, you're very, very lucky. In developing regions, children in poorest households are 4 times as likely to be out of school as those in the richest households. So here you see again the impact of poverty. Poverty-stricken families have more out-of-school children. Goal 3. Is about gender equality and empowerment of women. Where do we stand? Much progress has been made towards women and girls in education, employment, and political representation, but many gaps remain. Gender education, gender equality is reached in primary education up to the level of 67%, in secondary education 38%, but on university levels it is only 5%. That is decreasing at this moment. Gender and labor. Participation in labor force and working age is 75% among men and women 50%. And paid women workers outside agriculture have increased from 35 to 41%. Gender and parliament. 90% of countries have more women in parliament since 1995. Gender, women in parliament, global average proportion of women in parliament nearly doubled from 11% to 22%. Goal 4. Reduce child mortality. Where do we stand? What is child mortality rate? Child mortality rates are falling faster than ever. So the global number of deaths of children under 5, so the under 5 mortality rate, decreased in absolute numbers from 12.7 to 6 million children. That is a tremendous decrease. And the under 5 mortality per 1,000 live birth children decreased from 90 to 43. So there is a substantial progress and reducing child mortality, but more children can be saved from that due to preventable causes. So let us look into that. So if you look to the under 5 mortality rate, they were still very high in 1990, up to more than 200 per 1,000 live birth children. So 1 in 5 and more died before they reached the age of 5 years, and countries with such high figures decreased, and in 2013 there were no countries anymore with such high figures. But still, every day in 2015, 16,000 children under 5 continued to die every day, most from preventable causes. And child survival must remain the focus of the post-2015 development agenda. And if you look to this, where it is, especially the newborns are at risk up till day 12, 14, but especially the day of birth, that is the day also of death for many children. So what is the medical cause of child mortality in developing countries? It are diarrhea, lung diseases, malaria, measles, accidents, AIDS, and neonatal causes. But what are the underlying causes of child mortality? So malnourishment and death is, of course, the result of insufficient food and disease. And of course, insufficient access to food, and insufficient mother and child care, and insufficient health care, and unhealthy environment. But they are based on insufficient education and political, economical, social, and cultural contexts. So the potential sources are still in the hands of the leading people in a country. So much could be prevented if you have more and better policy matters in a country. So infant mortality rate is related to poverty. Children born into poverty are almost twice as likely to die before the age of 5 as those from wealthier families. So reducing socioeconomic disparities are critical to further accelerate progress in child survival. And mothers' access to education is a survival factor for under 5-year-old children. Vaccination coverage. It increased from 73 to 84 since 2013. When we look to, for example, measles vaccination. And measles vaccination prevented nearly 16 million deaths between 2000 and 2013, because measles is a horrible thing, especially in Africa, and children malnourished. It is still a horrible issue. Goal 5, improve maternal health. Where do we stand? What is maternal mortality? It is the death of a woman while pregnant or within 40 days of termination of live birth pregnancy, irrespective of duration and site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. So let me give you some numbers. In 1990, 430,000 mothers were dying. In 2008, it were still 340,000. But it decreased. The deaths per 100,000 live births went down from 380 to 210. But imagine still 210 maternal mortality per 100,000. That is incredible. So despite progress every day, hundreds of women die during pregnancy or from childbirth related complications. And these are the figures. They're quite high. So that is, and the dark red regions, 1 in 100 women die due to mortality. That is huge. Imagine that it should happen in the Netherlands with 200,000 mothers giving birth. It means that we should have many, many women dying from giving birth. But it is still going on. And what are the causes? Abortion and miscarriage, sepsis, indirect causes, hypertension, and hemorrhage after giving birth. So all these can be prevented. What are indicators of progress in combating maternal mortality? Pregnancy is being checked, births taking place under expert supervision. Teenage pregnancy, lowering of the percentage of teenage pregnancies, unmet need for family planning, and use of contraceptives. But in 2014, only 50% of pregnant women in developing regions received a minimum of 4 antenatal care visits. In rural areas in developing regions, only 56% of births are attended by skilled health personnel compared with 87% in urban areas. This is really something forgotten in primary health care, that you really need professionals guiding pregnant women. And then on top, we don't have enough data about this, so it might be worse. And then the issue of teenage pregnancies, that is still going on in the world. So the teenage pregnancies per 1,000 people in most African regions are more than 100. So more than 100 per 1,000 girls are going to have a teenage pregnancy. And it is depending on poverty again. Poor families, poor girls have more teenage pregnancies than rich girls. And it is still going on even in the Netherlands, but not as much. Contraceptive use, and this is a hot issue. Many cultures don't speak about contraception and family planning. So the prevalence rate is quite low. When you only 10% of fertile women use contraceptives in these areas. Goal 6, HIV/AIDS combat and malaria. The number of people newly infected with HIV continues to decline in many regions of the world. So that was a quite successful program. HIV infections fell by 40%, and in absolute numbers from 3.5 to 2.1 million between 2000 and 2013. So what you see is people live longer with AIDS due to treatment, and therefore we never saw more people with HIV in the world than in 2010. Access to antiretroviral therapy has increased at a remarkable pace, averting millions of deaths. So that was quite a successful program. And it averted 7.6 million deaths from AIDS. Unfortunately, knowledge of HIV and HIV prevention remains low among young people. And one of the dramas in the world were orphaned children due to both parents dying from AIDS. Malaria have been averted between 2000 and 2015, primarily of children under 5 years of age in sub-Saharan Africa. So children are less and less dying from malaria. It has everything to do with the use of insecticide-treated mosquito nets. But there is a huge program on mosquito nets. TB has declined thanks to effective prevention, diagnosis, and treatment. Between 2000 and 2013, tuberculosis prevention, diagnosed, and treated people and saved 37 million lives. Goal 7, environmental sustainability. Deforestation has slowed, but global greenhouse gas emissions continue their upward trend. Drinking water. Improved drinking water sources, it went up from 67 to 91%. Thus, 1.9 billion people have gained access to piped drinking water since 1990. And here you see the proportion of people using drinking water, safe drinking water. And then you see again that Africa is not doing really very well because it is also sometimes not very densely populated, and it is very difficult to make piped water, for example. That is what I explained to you. Sanitation and defecation. Important issue, of course, when we speak about health. In Gouda, we have a very good sanitation system. But in Egypt, for example, these are pictures from 2009, it is still a mess, so to say. These are my feet in a toilet in Egypt. And you see the walls are full with features. No toilet paper. In Haiti, we have still people working into the sewage system. It is horrible but true. People make their jobs of clearing human excrement and not being appreciated. Their height. But there is improved sanitation. Since 1990, 2.1 billion people gained access to improved sanitation, and the proportion of people practicing open defecation reduced with 50%. And again, you see Africa on the lower side, less than 50% of the people had improved sanitation. Living in slums. Proportion of urban population living in slums in developing regions decreased from 30 to 39 to 30%. Air pollution, hot issue. And because air pollution is very bad for health. There are many polluted cities due to road traffic, and it is a hot issue. So Delhi is attributable to outdoor air pollution in 2004 per 100,000 people, went up to 500 per 100,000 people. And household air pollution is very, very important for many people still use firewood in huts to cook their food, and that gives a lot of dolly loss, more than 2,500 per 100,000 people in many areas in Africa. Greenhouse gas, it has increased. So that is very sad. Ozone, it disappeared nearly because we did a trick with fridges in which there is not the bad gas anymore, killing the ozone layer in the world. Goal 8, a global partnership for development. Where do we stand? So the official development assistance, the ODA, increased from 80 to 135 billion euros between 2000 and 2014. And it was given by different organizations among the World Bank, European Commission, you mentioned it. So more and more development cooperation money was going to poor countries. A 6-fold increase in funds. Telephone and internet. That is tremendous improvement. There is nearly nobody in Africa has not a mobile phone or is in the neighborhood of a mobile phone in the family. And internet penetration went from 6 to 43%. And a tremendous increase. And the official development assistance has plateaued in recent years after increasing significantly between 2000 and 2010. So what are the results of MDG on life expectancy? Trends in average life expectancy at birth by WHO region and globally since 1990. And you see that in Africa, it increases from 50 to 60 years in 2015. So in all areas, there is an increase in life expectancy. And especially the southeastern regions do well, and the Americas as well. So that is positive. The success of MDGs again proves that global action works. It is the only path to ensure that the new development agenda leaves no one behind. So conclusion, MDGs seem to be very successful. So my conclusions about MDGs are, MDGs have economic and public health dimensions because of the economy influences the public health. The public health influences the economy. MDGs are not always be met, especially in sub-Sahara Africa remains behind. There are reasons for optimism that Africa will meet MDGs. Between 1990 and 2015, improvements regarding MDGs are observed, and question about causal relationship between MDGs and improvement remains. But success of MDGs justifies the Sustainable Development Goals which were formulated in 2015. Now, I'm very sorry for all these figures, but you see, it is important to get an idea through figures about what is going on. And you will even get more, but I have still some time. So because of the success of MDGs, we developed Sustainable Development Goals. What happened? Of course, there was an ongoing discussion about MDGs and why nations fail. And that in 2012 was a very important book, The Origins of Power, Prosperity and Poverty. So what does this book say? It is written by the famous Niall Ferguson, sir. He said, origins of power, prosperity and poverty, theories, hypotheses that don't work to explain why nations fail are culture, lay of the land and geography. So he said, let us try to explain it again. He says poverty countries are related to specific history of political institutions with exclusive economies, like in Egypt, North Korea, and former Spanish colonies in South America. What are exclusive economies? And these economies extraction of resources from the many by the few. No property rights and no incentives for economic activity. So if you don't have the right of property, what we have, for example, in the Netherlands, then it is part of an exclusive economy. And in poor countries, the political institutions regarding they show that power is in hands of the few, with incentives to maintain and develop extractive economic institutions for their benefit. The use of obtained resources, they use obtained resources to cement their hold on political power. Prosperity countries are related to history towards political institutions with socio-democratic character, like the Netherlands, with a widely distributed political power in a pluralistic manner, and an amount of political centralization so as to establish law and order for liberty, state of law, and justice. So prosperity countries are related to what we call inclusive economies, enforcement of property rights for everybody, creation of a playing field, encouragement of investments in new technology and skills, resulting in industrial development and industrial revolutions. For example, England, Germany, France, and the United States. And then we have Martha Nussbaum. She is a philosopher, and she is not very happy with only the economic perspective. She speaks about countries should create capacities. So that is Mrs. Martha Nussbaum. Last year she was speaking in Rotterdam, and her book Creating Capabilities for Human Development is worth to read. I show you shortly what she says. She says, in contrast with the more general definition of development, growth of the gross national product, she considers the support of 10 capabilities of basic conditions for development. In her perspective, poverty is more than lack of income. Poverty is as well being deprived of fundamental possibilities. So she says every democracy, every country, every government should support that people can develop 10 core capabilities. For example, being able to live to the end of a human life of normal length, not dying prematurely and before one's life is so reduced as to be not worth living it. bodily health, being able to have good health, including reproductive health, to be adequately nourished and to have adequate shelter. Bodily integrity, being able to move freely from place to place, to be secure against violent assault, including sexual assault and domestic violence, and having opportunities for sexual satisfaction and choice in matters of reproduction. Senses of imagination and thought. I go to give them to you so that you can read them all, but it is, for example, about adequate education, including but no means limited to literacy, basic mathematical training, and scientific training. And she speaks about development of emotions, about practical reasons of being able to form a conception of the good, engage in critical reflection about the planning of one's life, and affiliation with people, and also with animals. The capacity to play and to control over one's environment in the political way, thus having the right of political participation, protection of free speech and association. And material, being able to hold property, both land and movable goods, and having property. So she says, people have the right to develop their own capacities, and it is the responsibility of governments to make sure that it happens in a country. And if you look to sustainable development goals, you see this perspective about inclusive economies and capacities of human beings coming back. So there are new sustainable development agenda in 2015, and they are about dignity, about people, about planet, about partnership, about justice and prosperity. So here you see the influence of Martha Nussbaum. If you realize our ambitions across the full extent of the agenda, the lives of all will be profoundly improved and our world will be transformed for the better. So again, the United Nations, they define these SDGs, and it are 17 goals and 169 targets. You can imagine that I can't discuss all of them. But let me try. Justice, promote safe and peaceful societies with strong institutions. That is what Martha Nussbaum said. Prosperity grows, a strong, inclusive and transformative society. The influence of the book of Ferguson. Catalyze global solidarity for sustainable development, and on the planet level, protect ecosystems for all societies and our children. This is about dignity of people and poverty and fight inequality. And people, healthy lives, knowledge, and inclusion of women and children. So here are the 17. I'm going to show you some of them. So end poverty in all forms everywhere. End hunger. Healthy lives. Quality education. Gender equality. Clean water and sanitation. Affordable and clean energy. Decent work and economic growth. Industry, innovation and infrastructure. Reduced inequalities. Sustainable cities and communities. Responsible consumption and production. Climate action, life below water, life on land, and peace, justice, and strong institutions. So promote peaceful and inclusive societies for sustainable development and provide access to justice for all and build at all levels effective, accountable, and inclusive institutions. And it is about global partnership and sustainable development. So a small overview, what you can say up to 2018, while people overall are living better lives than they were a decade ago, progress to ensure that no one is left behind has not been rapid enough to meet the targets of the 2030 agenda. The rate of global progress is not keeping pace with the ambitions of the agenda and necessitating immediate and accelerated action by countries and stakeholders at all levels. So if you read newspapers, there are reasons to be less optimistic. And that is what you see happening since 2015. We have now countries in which we have dictators are not really interested in developing countries. We have funny people in England who want to have Brexit. We have a president of the United States who really says, I don't want to become, remain a member of WHO and the United Nations. So there is a change in the policy, although we want to have sustainable development goals. And only 45% of the world's populations are covered by at least one social protection cash benefit. There were disasters in money. World hunger is on the rise, again since 2015. Stunting, wasting, and override still affected millions of children under the age of 15 in 2017. Births attended by skilled health personnel increased globally, optimistic, from 62 to 80%. And under 5 deaths fell from 99 to 5.6 million. The HIV rate incidence for women of reproductive age in sub-Saharan Africa is 10 times higher than the global average. The world is not on track to end malaria by 2030. More than half of the children and adolescents are not achieving minimum proficiency in reading mathematics. More trained teachers are needed for quality education. So there are many people giving lessons which are not qualified, especially in sub-Saharan Africa. Child marriage in Southern Asia decreased by over 40% between 2016. So that is really an improvement. But women spent about 3 times as many hours in unpaid domestic and care work as men. So here you see not an optimistic era, an atmosphere, but it is more looking to how big are still the problems so that we are inspired to do more. 3 in 10 people lack access to safely managed drinking water services. 6 in 10 people lack access to safely managed sanitation facilities. And 4 in 10 people still lack access to clean cooking fuels and technologies. Earning inequalities are still pervasive. Men earned 12.4% more than women in 40 out of 45 countries with data. Youth were 3 times more likely to be unemployed than adults in 2017. 42 million died from ambient air pollution. Damage to housing due to natural disaster showed a statistical significant rise between 1990 and 2013. And 93% of the largest companies are now reporting unsustainability. So that was quite an improvement. And then the Paris Agreement is accepted by most countries on Earth, but some big ones like United States left again. Conserve and sustainable use of the ocean, seas and marine resources for sustainable development. Now that is not going well, with an increase of acidity, for example. Land degradation threatens the security of development of all countries, and the Red List Index shows alarming trends in biodiversity decline for mammals, birds, and so on. And more than 560 different trafficking in person flows were detected between 2012 and 2014. The proportion of prisoners held in detention without sentencing has remained almost constant in the last decade. So the SDG report of 2018 was less optimistic, and they gave not really what was going good, but what still is bad. So the progress in 2020, let me end shortly. This progress is really inspired by Corona. What you see is a huge influence of Corona policy of WHO on the Millennium Development Goals. Poor people are suffering more and more. People who only have income per day, what do they do in COVID times? What is the influence of staying at home on people? So the report goes in the direction of COVID. It has to be prevented, and it has to be handled. But if you look on world perspective, you could say that it is special directed to rich elderly people in the world. But the poor young people, they really don't benefit from the COVID prevention. And that is what you see in the report now. So there is a lot of worry about the effects of COVID and the COVID control on the poor people in the world. So it ends with everything we do during and after this crisis must be with a strong focus on building more equal, inclusive and sustainable economies and societies that are more resilient in the face of pandemics, climate change, and the many other global challenges we face. That is what the Secretary General of the United Nations tells us. So there is not a lot of optimism at this moment, especially due to COVID-19 in the world. Thank you for your attention. Are there questions?
There were questions for the coffee break earlier on, but I guess we have a coffee break now.
Okay. So Jan, was it a little bit clear?
Yeah, to me. I hope for the students as well.
Is there any student who wants to say something about it? I warned you about a huge amount of information, but if you reread it now, I will send it to you. It gives you a very good impression about different dimensions, I hope. about Millennium Development Goals and Sustainable Development Goals. Simone Omstede, I see you laughing. What do you have any comment?
I'm sorry, my roommate talked to me.
I see. Anybody else?
Okay, if not, then Paul, thank you very much.
Yeah,
And see you next time.
thank you.
And I see the rest at 11 after a coffee break. Other session, other link. So please.
Okay, so we meet again speaking about female genital mutilation.
Yeah, that's your next up.
Okay, thank you very much.
See you then.